Hey everybody, we're going to be talking about Lexapro today. We're going to talk about Lexapro side effects. We're going to go over some specifics about Lexapro and why Lexapro is actually considered to be one of the cleanest SSRIs compared to the other antidepressants out there. We'll go through the super common side effects people see with Lexapro. We'll go over the rare but super important side effects that everybody should be aware of. And then we're going to end with a handful of questions that we pulled together from the last month or so. So just to start things off, this is the Stahl's psychopharmacology book that we use. It just has a lot of really good pictures and diagrams explaining a lot of the things that that we talk about. I was able to pull better pictures than I did last time for the last video that we did. But I used a few more pictures, so I just wanted to highlight them here. And before I actually talk about Lexapro and why it's a clean medication, I wanted to talk about the precursor to Lexapro, which is actually Celexa. Celexa, if you see the molecule in the picture there, Celexa has an S and an R enantiomer of the drug, and that means that it's a mirror image of one another. And the R citalopram, that's what Celexa is, citalopram. The R version actually has extra qualities to it that give it side effect. And this is actually a better picture. Let's see if we can get it on camera there. That little pink doodad up in the mirror is a histamine, antihistamine component. I couldn't find that picture online, unfortunately, but that was the better picture. That gives off more side effect than what Lexapro does. And we'll jump right over to Lexapro. Citalopram. Not very inventive about how they came across with that medication. It's literally S-citalopram, or from Celexa to Lexapro, it's Celexa, Lexapro. Yeah, just simple play on words. But because it doesn't have that R enantiomer from Celexa, it is just the good stuff of Celexa, and that's what Lexapro is. That's why it's considered a very clean SSRI. There's not a whole lot of extra, at least not that we know of. There's not extra involvement with either histamine or, in other SSRI cases, effects on dopamine, effects on norepinephrine. Lexapro is considered to be the quintessential cleanest SSRI or antidepressant available. But it still gives you side effects, right? There's still a load of side effects with Lexapro and with really any SSRI medication. And this is the reason here, because of all the different types of serotonin receptors that are available in the body. And we are messing with serotonin. We are trying to influence serotonin for the better. And here we can see the subtypes of the serotonin receptors. So it's not just serotonin 1, 2, 3, 4, 5, 6, 7. And as a reminder, 5-HT is the shorthand for serotonin. So 1, 2, 3, 4, 5, 6, 7 different types of serotonin receptors, but you can break those down even further. 1A, 1B, 2C, etc. This is still my favorite little diagram of serotonin receptors and the general effects that it has on the body. This is the reason that we still get side effect from Lexapro, because of all these effects that you can see on the right-hand side, the right column going down the right side there. We just read it off from the top there: sleep, feeding, anxiety, neuronal inhibition or behavioral changes, vasoconstriction, memory, anxiety, cellular excitation, appetite, gut motility, cognition, learning, on and on and on. So if you take into consideration that you're affecting all those receptors, those serotonin receptors, and you're also thinking about how SSRIs work, considering somatodendritic theory, which sounds ridiculous of a theory, but it's why we think SSRIs and antidepressants take so long to work, but you still get side effect up front. I did a video on this a couple weeks ago. Hopefully I explained that in the most concise way possible. Check that video out if you're all interested. It does get a little bit deep though. Not going to go into it here. The idea here is that we are messing with a whole lot of serotonin receptors that can give us side effects. Jumping into the very common side effects, I'm going to show you what I do with patients in the clinic. Whenever I have a patient that I'm suspecting of a side effect for any medication, not just psychiatric medications, I go over to drugs.com. I literally do this with the patient in the room. We put in the name of the drug. Lexapro. Just click on the drug first. You get this gold star. You know that's the medication that has the profile between the side effects, all the information for pregnancy, breastfeeding, drug interactions, dosage, et cetera, et cetera. So I'm going to press on the side effects tab because this is going to bring us to a page where it gives us everything. And up front at top, there's a black box warning, which I'll talk about later. There's side effects in more common language. And then the further down you scroll, you'll get to a section for healthcare professionals. I think this is the most useful even for patients because it gives you a general percentage of the side effects and how often they are likely to occur, at least with the information that we have. Jump back to the slide here. So that's what I use to pull all that very common side effect that you see here. I didn't label any of them that are just straight up common, which is between 1 and 10%. And there's a lot of those too. So if you are curious about what other common side effects are, definitely take a look at that profile on drugs.com. Very common side effects: insomnia, headache, somnolence, meaning tired, nausea, diarrhea, and then no guy's favorite, ejaculation disorder. I mean, that's pretty high for being the cleanest SSRI out there. That there's a fairly high percentage chance, almost 15% of men can get a ejaculatory disorder. Headache is super common. You're almost, 24%, almost 1 out of 4 people are going to get a headache with this medication. These are typically time-dependent side effects. So even though these are the common ones, we would expect these to wane away over the course of a 2 to 4 week period. Time-dependent side effects are back to that somatodendritic theory that you're going to get side effect up front before you get the efficacy. And as you're getting more efficacy, the nerves become more sensitized to the medication, basically, and they stop listening so much to all the extra serotonin floating around in the brain. There's rare, but certainly the side effects that nobody wants in any situation, in any case. Mania, and rare meaning less than 0.1% or somewhere between 1 in 1,000 or 1 in 10,000 patients that are put on this medication, maybe even more. If you look on drugs.com, there's a few sections on multiple drug pages where it'll say that they don't know how often that the frequency occurs because it's so rare. Mania, instead of maybe taking us out of our depressive state, but then pushing us into a manic state. Somebody that was inappropriately diagnosed with depression rather than bipolar, that can happen. We can spark suicidal ideation. Rare, but it does happen, and that's the hallmark point of the black box warning. It can drive psychosis. It can drive serotonin syndrome. I have not seen serotonin syndrome. I've never actually come across it. My wife, being a psychiatrist, has not actually come across it, has not heard of her patients being hospitalized with it and then getting discharged back to her with it. So it does happen, but and it is very serious. You usually inpatient, and many people put in the ICU for it. Can happen, but very rare. There's extrapyramidal symptoms, EP symptoms. Extrapyramidal symptoms are akathisia, Parkinsonism due to from a medication, tardive dyskinesia, dystonia, and then there's something called neuroleptic malignant syndrome. Those are all not fun to have. Akathisia, I did a video on last week if you want to check that one out. That one is readily reversible if you are aware of it. And then ironically, I actually, after I did that video, I said in that video, I've never actually come across it. And then I don't know if it's just dumb luck or me being primed to look for that sort of stuff. The next day in clinic, I came across a patient who they were ramped up on their Prozac from 20 milligrams to 60 milligrams very quickly. And then they started getting that anxious bounce. So that was actually very ironic that I actually came across akathisia after I did that video. Pseudoparkinsonism, tardive dyskinesia, dystonia. I'll try to maybe make some videos on that down the road later. Just kind of depends on what we have time for. Black box warning. The black box warning, that's actually a video that I would like to do with Allie, because there's a lot of controversy behind black box warnings and how they come about. Usually it's from a whole mess of legal issues. But the black box warning on SSRIs in general and on Lexapro is suicidal thoughts and behaviors, an increased risk of suicidal thoughts and behaviors shortly after taking the medication. It does seem to be more likely in the younger that you are, less likely as an adult. And usually black box warnings are also those things that pharmacists will prompt you on also before you pick up the medication. So I'm going to jump into some questions and comments that we've had specifically about Lexapro over the past month or two. Defiant says, "Hey doc, can Trazodone and Lexapro be taken together with causing serotonin syndrome?" The short answer is yes. Reading that question, I was like, oh, that's another great video to be done, because Trazodone can affect serotonin, but it does not affect serotonin in the same mechanism that an SSRI does. Because of the differing mechanisms, the Trazodone and Lexapro absolutely can be taken together. Regarding serotonin syndrome, does it increase serotonin syndrome risk? Yes, it can. It's still a very low risk, not a zero risk, but a low risk. I myself would not hesitate to double up on those two medications. And I don't know of any psychiatrist, I don't think Allie hesitates to double up on those medications either. Ashuvijay, if I said that right. This one was actually from 3 months ago. When should I take Escitalopram or Lexapro? In the morning or at night? I plugged down there a little screenshot of the half-life of Lexapro. It's pretty long. It's 27 to 32 hours or so. It's over a day. It takes about 6 days for it, most all of it, to get out of your body. So the answer should be, it shouldn't matter, as long as you are consistent to take it consistently to get an even steady state in your body. Allie made the point to me that Lexapro can make you a little, for some people who are super sensitive to SSRIs in general, you can get a little bit of a tired or sedated feeling through the first half of the day or so after you ingest Lexapro. So if you are somebody who's super sensitive, you might want to take it at night. That usually mitigates that tired feeling. Otherwise, it really side effect, not being a problem, it really shouldn't matter as long as you're consistent. Sometimes Charlotte says, can Lexapro be taken intermittently for PMDD, premenstrual dysphoric disorder? The side effects are unbearable. No libido, no orgasms, extreme fatigue, complete flattening of emotions, thyroid dysfunction, anemia. Had blood work done beforehand, and all that was apparently clean. Please do a video on how to taper off safely. We've done videos on tapering medications. It's actually in our antidepressant mini series that we can post in the comments. So check that one out. Can it be taken intermittently? Really, for PMDD or for anything, really the short answer would be I would not. You might come across somebody that prescribes it that way, but it's one of those medicines you want to keep in a steady state. You want to take it as consistently as possible, because you are, and this kind of goes back to the theory of why and how SSRIs work, you want to consistently expose your nerve cells to that medication, to that increased amount of serotonin, so that your nerves literally become desensitized or desensitize themselves from the serotonin with certain receptors. And if you are intermittently taking it, you really, my thought is you would only likely prolong any side effect, and you really wouldn't feel good on it at all. And if you're feeling that bad with libido, fatigue, emotions all over the place, even anemia, because anemia is not super common, that is probably just not going to be a medication for you. It's not, I would not recommend that to any patient. I would be looking for an alternative means to try to treat that. This is Norm. What's up, Norm? This is one of our good friends. Comments a lot. Finally got him in the video here. Do you think that Prozac is better than Lexapro that I'm on? That is the big picture would say one is not better than the other. The STAR-D trial is the biggest SSRI antidepressant study that's ever been done. And that study would say one is not better than the other. On an individual level, it might be. On an individual level, because all those serotonin receptors and how sensitive individuals are to those side effects or lack thereof, it is very much individualized. That's why if one SSRI doesn't work for somebody, that's why we will switch them to a different SSRI. The efficacy is not, it can be better with a different medication. And so saying Prozac is better than Lexapro, I can't say that. Prescribing wise, I typically go to Lexapro first, just because of the clean profile. Lavorka asks, does it work with escitalopram, referring to the Wellbutrin video? Yes. The short answer is yes. Wellbutrin is used all the time as an additive medication. We talk about those additive medications in the antidepressant mini series as well. As long as you don't have a contraindication to Wellbutrin, as long as you are on a good steady state with your Lexapro, and we're sure that we're not having extra side effects, add on the Wellbutrin afterwards. Yeah, absolutely. You can, we do that all the time. Mr. Singh asks, says, taking Lexapro 10 works on my anxiety. However, it makes me sleepy, makes my critical thinking ability slower. I added Wellbutrin and worked wonders for a few days, but then led to anxiety. What should I do now? That's a hard question because there's a lot of questions that I have that would determine how I would change that with a patient. So assuming that we're on Lexapro 10, it was working really well, but we're getting that sleepy quality. This kind of refers back to the previous comment where maybe Singh here is super sensitive. You might just want to take it at night and see if that all those sleepy, slower thinking qualities are really mitigated through sleeping, and you wake up and you don't feel those the next day. If you're feeling it a full 24 hours, those sleepy qualities, before I would change before I would add on another medication, I would probably think about maybe even trying to cut that dose down somehow. 10 milligrams is relatively low, but if it's effective, it's effective. Allie's going to have a video out on the efficacy of low dose SSRIs that will be coming out, and that this kind of speaks to that. Maybe cutting that in half, you still get the efficacy that you're looking for without getting those side effects. If that doesn't work, adding on Wellbutrin can be effective, but one of the more common side effects of Wellbutrin is anxiety. And so I'm not totally shocked that if your primary diagnosis was anxiety and we added on Wellbutrin, that it spiked the anxiety. But I understand the concept there. The thought is, well, if we're tired, if we're fatigued, brain drain, mushy brain, whatever you want to call it, add on Wellbutrin, which can help give you a little bit more juice. There's a good side effect, particularly for patients that are hypoactive and depressed, helps give them some energy, but it can lead to anxiety. The short of it is, I would do a couple other things before adding on an adder medicine in that situation, given the limited information that I have there. But Wellbutrin does not seem to be the add-on medication that you are going to look for. Lexapro, can I take it with mirtazapine? Short answer, yes. Mirtazapine has a totally different mechanism of action compared to Lexapro, and you should, those are used commonly together, relatively frequently. Kimberly is on week 6 of Lexapro. I feel much better. Still some lingering anxiety and tension all day. Didn't notice much until week 5. Hoping for further improvement in the next 6 weeks. And that's a good thought process to have. She's making that comment on our antidepressant miniseries of when will it work. Allie goes through and explains that patients with these medications, especially if they are not giving you intolerable side effects, is a good thing. If Kimberly here had of a good response in the first 6 weeks, still some lingering symptoms, there's a very good chance, very, very good chance that the remaining symptoms are going to dissipate while staying consistent with Lexapro. And if check that video out if you want a more detailed explanation. Allie goes through a couple of studies, a couple of really good studies for the importance of being consistent with those medications when you can tolerate them. Which would you recommend more for anxiety, Lexapro or citalopram? Allie's answer is either one. They should be equally effective. My answer is I go for the less likely to give you side effect. I default to Lexapro more commonly. And that's going back to the very beginning of this video where citalopram can have that antihistamine property to it on the R enantiomer. Lexapro is just cleaner. So I vote for Lexapro, but definitely talk to your own prescriber about it. Randy, taking Lexapro. Unfortunately, I also suffer from drinking. Not a good combination. Worst anxiety and panic attacks I've ever had combined. That I had a couple questions about that one because my initial thought was, well, if our state of life is having a drinking issue already, and then you added on the Lexapro, it was likely the Lexapro that was giving you bad side effect or unwanted side effect. But Allie also pointed out to me that clearly, especially if you're a heavy drinker, coming back off of withdrawal or sobering back up can really drive anxiety. And the combination of the two, polypharmacy, considering alcohol a drug, polypharmacy is absolutely something that can amplify side effect. Adding on Lexapro might have done that. But I lean towards, my personal opinion is I lean towards Lexapro maybe not giving you a good side effect or being the predominant driver of that anxiety if you weren't having anxiety or panic attacks or significant anxiety or panic attacks before that. I don't know. I'd have to ask more questions about that. Miss Moose, thank you. Is Lexapro okay to take if you have high blood pressure? There seems to be contradictory info on this online. Yeah, it is okay. Let's show you. Let's go jump over to the drugs.com here. On the Lexapro page here, I'm just going to Control F here. Hypertension. Under the cardiovascular side effects here, you can see hypertension. Let's just finish that out there. Hypertension in the uncommon section. So 0.1 to 1%. So 1 out of 100 to 1 out of 1,000 people, somewhere in there, is going to develop hypertension from this. Pretty uncommon. Pretty darn uncommon. You also notice, though, that right here, there is hypotension. So if you have high blood pressure, there's actually an uncommon possibility that you might actually drop your blood pressure by taking the medication. In short, though, hypertension, not a super big concern. Could it happen? Yeah, it could. It could happen. Definitely continue to monitor yourself, your vitals, your blood pressure while taking the medication. But if there was hesitation, overall, there's low possibility, not zero possibility, but lower likelihood that you're going to get hypertension from it. If there are any other comments or questions or ideas that you'd like to refute, leave comments in the section below. We do check them all. We try to get to all of them. Patreon's coming so that we can funnel out more questions and more ideas and make specific videos for our fans. That way they're directed to the fans. Next week, I'm still kind of undecided whether I'm going to talk about Lexapro side effects or if I was going to talk about some black box warning stuff. I don't know. I'm going to talk to Allie about that. Otherwise, yeah, next Tuesday we'll do it again. Thank you.